room.
Okay, my presentation is over elephantitis by Katrina. What is elephantitis? It is a tropical disease that affects the limbs and genital areas. It causes the affected area to swell up and fill with fluid. When it is swelled, it looks like an elephant's foot, hence the name. There are two separate types of elephantitis. One is filarial elephantitis, which is caused by a parasitic worm such as Brugia malaya or Wucheria bancrofti. 90% of elephantitis is caused by Wucheria bancrofti worms, which is passed on to humans by the mosquito. The second type is non-filarial elephantitis. It includes other components that can cause lymphedema, such as environmental circumstances, exposure to certain chemicals, and genetic factors can also cause elephantitis. You can see in this picture where his face is swelled up and it can't be fixed. Toxicity. Toxicity occurs after the worm has grown and settled near the lymphatic system. It grows several times its original size and produces a large number of worms. The worms slowly secrete toxic material into the lymphatic system, which causes subtle changes into the immune system of the body. The immune system will steadily weaken until it can no longer handle the growth of the infected parasite, which will then result in the buildup of fluid in the affected area. There are 3 stages of lymphatic filariae. The first one is pitting edema, which is the swelling of a limb along with pain or discomfort. The symptoms are worse during the day, and they tend to get better at night because you're lying down. Also, keeping the legs in an elevated position will also help swelling to be reduced by morning time. In this picture, you can see where the lower leg is severely swelled, which probably causes a lot of pain. So when he elevates it at night, hopefully it goes down. The second stage is spontaneously irreversible lymphedema. In this stage, the skin hardens and the swelling will not go away by morning, and it starts to grow progressively. The third stage is lymphostatic elephantitis. This is where the condition becomes irreparable. The skin changes, and it may not be possible to grasp the skin with fingers at this point. Elephantitis is the last stage of lymphedema. And here you can see her face has been affected. Her cheeks are kind of hanging down. How is it contracted? The infection is spread from person to person by mosquitoes. The accumulation of microfilariae from repeated mosquito bites over several months to years are needed for outward symptoms to present themselves. Most often, elephantitis is the result of filarial infection transmitted by the female mosquito. The symptoms are enlarged limb, area becomes hard and thick, outer layer will develop ulcers and give a pebble appearance, which means it's kind of like a rough surface. Fever, fatigue, pain and tenderness is in the affected area, red streaks indicating inflammation in the blood vessels. It can take several years before the symptoms begin to show. In this picture you can see where her feet are swelled and her ankles, and there's little dots on there, which means that it's progressing into the later stages. Some other symptoms are caused by secondary issues such as depression, self-esteem problems, and physical limitations. Whenever your legs and arms are swelled severely, you can't work or walk properly or do anything, and you become depressed because you have to stay in the house and not be able to leave or do what you want to do. Some of the tests that you have to take in order to be diagnosed are blood tests, and they're best to be done at night because this type of parasite is nocturnal, and the likelihood of a sample actually containing the parasite would be better to do it at night. Another test is the actual nematode to be identified within body tissues or fluid from an individual experiencing symptoms or infection. Like we said before, the symptoms could take years to show, so by that time the infection is probably pretty bad. The treatments include some medications such as doxycycline and ivermectin. You can have surgery to do it. You have to go to the actual site that you were bit and remove all the tissue. And you need to practice good hygiene. Where it's common at is in the third world countries, and there isn't clean water and stuff, so you have to make sure that you probably boil the water and stuff to make it clean and sterile. Here's an example of a hand that has been infected, and it's just her thumb and her index finger. The rest of the fingers look okay. This one is a picture of a foot or leg that has been infected, and it looks to be in the later stages because you can see the skin has already begun to harden, and there's little indentions that probably popped. When it's present in the genitals, it can cause urination difficulties, which can then lead to secondary issues. And here's a picture of it in the genitals. And that's it.